A prominent trend in cosmetic enhancements known as the pursuit of an ageless appearance, often referred to as aiming for a perpetual mid-30s look, has sparked intense debate within the beauty and medical communities, with experts highlighting both its appeal and potential pitfalls. This modern approach to facial rejuvenation focuses on subtle, natural-looking results that preserve youthful features without obvious signs of intervention. Techniques involve advanced procedures that address deeper layers of the face, repositioning tissues to restore contours and vitality in a way that appears effortless and timeless. Patients increasingly seek these treatments earlier in life, hoping to maintain their appearance at a preferred age rather than dramatically reversing years. The philosophy emphasizes continuity, allowing individuals to age gracefully while intervening proactively against visible changes. However, renowned specialists caution that overzealous pursuit can lead to unnatural outcomes, particularly when procedures are pushed too far. Skin and tissues may respond unpredictably over time, resulting in distortions that are challenging to reverse and can appear odd or altered. For instance, excessive tightening might cause relaxation in atypical patterns, shifting the face into territory described as weird or unfamiliar. Once reached, correcting such results becomes complicated, requiring careful consideration and sometimes limited options for restoration. Gender differences play a role, with some procedures suiting certain facial structures better than others. Aggressive interventions on male patients in particular risk creating looks that seem unnatural or exaggerated, diverging significantly from typical masculine features. The cultural drivers behind this trend include heightened awareness through social platforms, where filtered images and constant comparisons fuel desires for perpetual youth. Content creators and public figures face unique pressures to maintain flawless appearances to sustain engagement and relevance. Surgeons note evolving standards of good work, now measured against digital enhancements rather than natural baselines. This shift complicates expectations as real procedures cannot replicate artificial perfection but aim for enhanced versions of one's own features. Deep plane techniques, a cornerstone of many contemporary facelifts, operate on foundational anatomy, lifting muscles and fat pads for longer-lasting, harmonious results. Unlike surface-only methods, they minimize tension on skin, reducing risks of pulled or windswept appearances. Recovery times have improved, with smaller incisions and refined methods allowing quicker returns to daily life. This accessibility contributes to rising popularity among those in their prime years noticing initial laxity. Patient motivations vary, from boosting confidence to aligning external appearance with internal vitality. When rooted in personal satisfaction, outcomes tend to be more fulfilling than those driven solely by external validation or societal expectations. Consultations emphasize realistic goals, with surgeons advising on anatomy-specific suitability rather than age alone. Tissue quality, skin elasticity, and overall health determine candidacy more accurately than chronological years. Myths persist, such as assumptions that these procedures are exclusively for women or older individuals. Men experience similar aging processes and can benefit from adapted approaches that respect their bone structure and aesthetic norms. The industry's future appears geared toward intentional aging, enhancements that support elegance across decades while honoring individual identity. Rather than freezing time, the focus shifts to proportionate, believable evolution. High-profile cases often ignite public discourse, with confirmations of procedures normalizing discussions around cosmetic choices. Individuals frame decisions as empowering, about feeling one's best rather than conforming to uniform standards. Personal stories reveal diverse perspectives. Some embrace interventions as self-care, others prioritize natural progression. Both paths can represent graceful aging, defined individually. Complications and regrets underscore the importance of selecting qualified professionals. Board certification, extensive experience, and transparent communication about risks ensure safer journeys. Non-surgical alternatives like fillers, lasers, and skincare regimens offer complementary options for maintenance, often preferred for minimal downtime and gradual improvements. Psychological aspects warrant attention, as body image influences mental well-being. Supportive environments and realistic counseling help patients navigate decisions without undue pressure. Innovation continues, with advancements promising even more precise, personalized results. Stem cell research, regenerative therapies, and hybrid approaches may redefine possibilities in coming years. Ultimately, the conversation around ageless beauty reflects broader societal values on aging, self-expression, and authenticity. Balancing aspiration with acceptance fosters healthier attitudes toward time's passage.